Hello, everyone. My name is Amri Dimasanti. I'm doing a presentation on a disorder that I picked out. It's NREM, sleep arousal disorder. So yeah, let's get to it. I'm gonna share this real quick. All right, I hope you can see this. All right, wonderful. So the reason I picked non-rapid eye movement sleep arousal disorder was because a lot of my friends, my close friends, they experience trouble in their sleeping, which include sleep talking, sleepwalking, or night terrors, or just very low quality of sleep. And I myself, you know, haven't had a big problem with sleep, so I was kind of interested in how I could improve my friends' sleep life, make their mood better for the day, and resisting that urge of morning coffee and the like. So, uh, what is it basically? What is NREM sleep disorder? Basically, it's characterized as occurring events of incomplete awakening from sleep that happens to a patient. During the event, the patient experiences sleepwalking or sleep terrors. Um, Sleep terrors is basically the event where you're kind of like awake and you can see the room, you like outside of your body, and there's like a demon or some kind of ghost looking at you like from above, and it's kind of scary, so hope you all don't have to experience that. um there's sleepwalking, sleep terrors, and sleep talking is basically a symptom of the disorder. So who gets affected by this disorder basically? It's mainly children. It's more commonly for children and not for ages above 20. Um, it's children from the age of 3 to 13 are more susceptible, and with more cases compared to ages 15 and up. Uh, cases Case studies have shown that genetics do play a big role while gender does not. Um, so if you have a family member, a relative, sibling, or cousin who has had experienced this sleep disorder, there's a big chance you might get it. And if you are a girl or a boy, it doesn't matter. Basically, they equally get the same amount of sleep disorders. DSMV symptoms include family history, as we have discussed. It's a lot to do with genetics. The second is daytime sleepiness. Because of lack of quality sleep, you will be less responsive to questions asked upon you. Basically, someone who sleeps in class and the like. The next symptom is sleep terrors and sleepwalking. Sleep related sexual abnormal behaviors. This is basically kind of like moaning in bed or sexual arousals that happen in bed, or sometimes there are some cases where patients they masturbate in bed. The next E is confusional arousal, which means when you wake up from sleep, you feel confused from a dream, but you cannot remember that dream, and then you just wake up startled and confused. So that's confusional arousal. Most of the cases and symptoms, a lot of patients do not remember their dreams, or if they have been sleepwalking, they wouldn't remember what they were doing, what activities they were doing while they were sleepwalking, and it's mostly just a family member telling them that they did this and this in their sleep. Treatment case study. So there was a case study on non-REM parasomnia that had 512 patients went through video polysomnography. They were exposed to this treatment, and they were identified being the number one symptom that 40% of them had were diagnosed with sleepwalking. Second symptom is mixed phenotype with 23.8%. Symptom three was 10% with parasomnia overlap disorder, which basically means you both have the disorder of sleep terrors and sleep nightmares and sleepwalking, but you also have a REM disorder. So it's a combined sort of disorder. Um, Basically, the study was taking a bunch of people with sleep problems and sleep troubles and had been diagnosed with NREM, sleep arousal disorder, and they looked into it and tried to find out if there was a cure or which treatments functioned better than others. It it ended up pretty well in the events that one third of the case studies and treatments of the case studies involved non-pharmaceuticals, meaning the use of no drugs. Basically, it was just teaching them how to sleep better by improving sleep hygiene, which basically means making the bed neat before you go to bed, um, having the right food before you go to bed, brushing your teeth, making sure that your bed is clean, and that you are comfortable. You're not itching around while you're going to sleep. And yeah, that proved effective. It proved effective to one third of the patients. There is also CBT, which is basically, hold on, I have to check what, like cognitive behavioral therapy, which basically was a therapy that helped patients with problem solving. It helped them with the how to see the stress and anxiety in their life and narrow it down so that they can overcome their problems and see, the bigger picture rather than just a tunnel vision of that sort. And yeah, that also helped them. That also helped them with their sleep. Actually, sorry, it was promising. It looked promising. That and melatonin, which is basically a sleep-inducing drug, it is formed naturally in the body by hormones. When you turn off the light, those hormones start to produce in your body. So it's a naturally produced drug in your body, but you can also take it as a drug. There are some there are some substances where like pills and also inhaling devices that allow you to produce more melatonin to help you induce and gain that better sleep. So the next slide is about treatment and prognosis. Surprisingly, there is no cure for NREM disorders. Basically, after you get over the stage of being a kid into your teenage life, into the adult life, the the events happen less and less. Naturally, the disorders tend to go away as children grow into adulthood, but the remedies and treatments in reducing the intensity and frequency, if it gets out of control and gets super bad, even after the age of 18, let's say, those treatments include stress management, which means basically, that the problems of sleep is not sleep itself, but the anxiety and tension that you have into your life, the overthinking you have before you go to sleep, and all these thoughts that cloud your mind that enable your ability to get good sleep and often produce the symptoms of sleepwalking, sleep talking, and night terrors. So that's stress management. The next is sleep hygiene, as we've discussed before, removing all distractions, making sure you have a clean bed, making sure that your bed space is nice. And also a big factor is not combining your workplace with your sleep place. that kind of messes you up a lot. The next is removing sleep distractions, which is similar to sleep hygiene. The last is D, which is pharmacotherapy, the use of medical drugs such as melatonin and the like. And the next and last slide is what is life like for people with this disorder and implications for quality of life. I've actually noticed this from my friends when they tell me they have gotten good sleep, because I always ask them to. I ask them if they've slept well last night, like when I come to work. uh and generally speaking, when someone says they have had good sleep, their mood for that day is definitely brighter. And there is that saying, like, woke up on the wrong side of the bed, just means basically that you didn't get that quality amount of sleep and you become moody for the day. So sleep is just such an important thing. It it makes your mood better. It helps you become more healthy, stay at that weight that you want. And it also reduces the risk of having other health problems. And it's just a vital thing. And people with this sleep disorder are unable to obtain that. Um, some some of you must know, like, people that are constantly anxious, constantly looking around, or very tense. Or also the other spectrum is that they're not, you know answering questions as quick. They can be quite slow. That all revolves around how well you sleep. So if you are out there, you have trouble sleeping, or you have a disorder which revolves around, sleepwalking, sleep talking, get some help. Go to a doctor. Check it out. Get some therapy. Get some stress management if that is necessary. Or talk to a friend. Consult with them. See, like, how have they been doing. Or also, try these new things. Try the melatonin drug, the inhaling device, and just try to get the best sleep as you can. Thank you for watching my presentation.